EHRs, electronic health record systems. Physician burnout is a byproduct of poor EHR adoption and support, leading to a lower quality of care, lower patient satisfaction scores, strained team morale in the practice, and decreased revenue and profit. The Medical Advantage Group EHR Services team is here to help with a full spectrum of EHR services.
In the past, physicians were able to be experts at caring for their patients. Along comes the electronic health record, where it's a big change in the practice. Most of the time we're brought in by our clients because they're facing significant physician burnout, staff burnout, what they feel is working for the EHR instead of the EHR working for them.
So when we go into a practice, we'll often do a pre-assessment. Because we're in practices all across the United States, we see what works best for these practices. So we'll not only help them optimize their EHR, but we'll help them optimize their workflow.
We've done well over 1,000 provider implementations where we're able to look at the practice itself, analyze the needs of the practice, look at what programs they're in, not only federally like MACRA and MIPS, but also maybe commercially with some of the larger payers that they've joined in with value-based contracts. So our implementation team works throughout the process with the practice, getting them from point A to point Z through being successful in your pay-for-performance programs. So we've been brought in by health systems, practices that are private, as well as the vendor themselves to rescue as we call implementations.
Oftentimes we're called by health systems that are midway through implementation. They're finding that they just don't have the resources. So we'll come in and work as part of their team to finish the go-lives, finish the implementation, and then optimize.
So once a practice is live on an EHR, we start to look at what features or modules of their EHRs that we could turn on to make them more efficient, to make them more money, to make them more patient-focused.
We will sit with the practice, we will show them all of the advantages of engaging their patients on the portal and on the kiosk and using Messenger.
At Medical Advantage Group, knowing how and what the commercial payers as well as some of these federal programs want out of the dashboards allows us to go into these practices and really push the practices to be better at collecting data.
So what we'll do is we will go into a practice, we'll look at which measures the practice is going for, we'll make sure the EHR is set up specifically to capture that data.
It's all about efficiency, it's all about patient care, and it's about getting a return on the investment you've made on your EHR technology. Our US-based EHR support services consists of all certified EHR specialists that are experts in various fields of EHRs to ensure that when you pick up the phone that we have an expert for you.
We have worked in practices, a lot of us have been the end user before, so we know the frustration, we know what needs to be communicated.
It's a journey. There are constant changes in the EHR market. With different incentives that arise every single year. Not just 3 months, 6 months down the road, but 5 years down the road when you really need to be taking advantage of new programs at that point, not worrying about morale-busting EHRs.
To help your practice or health system solve your EHR challenges, contact Medical Advantage Group today.